Alright, so for this week's therapeutic exercise case, I had case 3. My patient, with his signs and symptoms and also some of his impairments, I believe he presents with lateral epicondylitis, and this is consistent with his work as well. He is a construction worker. He will be probably doing a lot of wrist flexion extension along with elbow flexion extension, so that can kind of explain why he is having some of these symptoms. So the first thing I would do is, if this patient came into the clinic, I would do some transverse frictional massaging. I'll do this just distal to the lateral epicondyle, and I would do this about 5 reps in each spot, and I'd move up and down for about a total of 10 to 15 minutes. So the first thing I'm going to go ahead and do is give your forearm a massage. If you have any increase in pain, let me know. I'll be kind of watching your expressions as well, so you can go ahead and relax. Again, like I said, I would do this for about 5 reps or strokes in each position, and then I'd move up and down, and that'd be for a total of about 10 to 15 minutes. Now I would also want to increase his range of motion, so I would prescribe some passive stretching. Now, he did test positive for the Mills test with 5 out of 10 pain, so that is a decent amount of pain, so I would want to modify some of the stretching positions so that he wasn't getting as much pain but still getting a stretch. So I would just decrease the amount of elbow flexion or elbow extension and wrist flexion. That way he was still getting a stretch, but try to minimize the pain. And I would do this 3 times for 30 seconds. If he couldn't tolerate the duration, I would cut the duration back, but I do want this to be kind of a low load, low repetition stretch. So what I'm going to do is I'm going to go ahead and place your elbow in a position of just a little bit of extension. Do you feel a stretch right here in this area? All right, so what I want you to do with your left hand now is to grab your right hand and kind of push it down towards the ground. Do you feel a little bit more of an increase in stretch? Mm-hmm. All right, so what I want you to do is hold that position there for 30 seconds. And then once we're done, you can go ahead and relax. All right, you can go relax. All right, so another impairment that I'd like to treat would be the weakness and pain in his wrist extension on the right side. Now, because he does have a lot of pain when the MMT was tested, I would want to start with a low-level sub-isometric. Again, this will stimulate some strength adaptation, but it will limit the amount of repetitive flexion extension he's doing. That way he won't aggravate and increase the pain that he's been having. So what I'd have him do is I'd have him go into slight wrist extension, apply an overpressure, and hold it for 10 seconds, and I'd have him do that about 12 times, and that way hopefully strength will increase, and then we can move on to eccentrics and then full concentric and eccentric. So what I'm going to have you do is, with your arm flat on the side of the chair, I'm going to have you lift this wrist about up to here. All right, now with your other hand, you can lower it a little bit. With your other hand, go ahead and provide some overpressure. Just push it down, but don't let your wrist drop. And what I want you to do is hold that for 10 seconds. If you feel you can press harder, you can press harder, but then you can go ahead and relax. Go ahead and relax. And we would do that for a total of 12 times. Again, if you can increase the pressure without any pain, go ahead and do so. We're just working on some of the strength of your extension of the wrist. Now, if you thought that was too easy and you didn't have as much pain, I would go ahead and progression to eccentrics, with the concentric phase being assisted. So I would grab a small hand weight or a dumbbell, and I would let the patient hold this with his wrist just off of the table. And what I would do is have him with his left hand go ahead and bring your arm up, or your wrist up to this position. Now you can go ahead and let go and slowly lower the weight towards the ground. Good. And now with your left hand, you can go ahead and grab and bring it up again. All right, and go ahead and slowly lower it down. Good. And if he progressed to this, I'd probably start him with low load, higher amount of reps. So I would start with maybe 2 sets of about 12 to 15 reps, and depending on how he feels, I could either increase the weight or increase the sets and reps. All right, for the last exercise for this video, I decided to do some strengthening of his supination and also allowing some overpressure into pronation, so that it will help stretch that muscle a little bit, because he was limiting range on his right side in supination. So with this exercise, again, I'm going to focus on the eccentric phase. So he's going to help his wrist into supination, and then slowly control the pronation of the band pulling back into pronation. I decided to do just the eccentric mainly. because I, again, wanted to avoid the repetitive concentric eccentric motions that may elicit some of his pain response. I prescribed this for 2 sets of about 12 to 15 reps. If he could handle this, I would then go ahead and add the active concentric supination part of it. But again, I just kind of wanted to minimize the repetition. So what I'm going to have you do is go ahead and grab onto this band, and keeping your elbow at your side and starting with your other hand, your left hand, I want you to kind of turn your palm facing up, and then slowly in control, just kind of let your wrist go back down towards the floor. Good, and now go ahead and do that again. All right, you can go ahead and relax. Now again, I want to focus on kind of a low load speed here. That way he's really just focusing on controlling it so that there is some strength, and also letting it go into full, or his available pronation. That way he gets some stretching of the supinator.